Got my eyes straight ahead, got my head in the game. With the red light on, I'm just waiting for the change. Keep my head down low. Let the wind
Hi, Jay Fallon. Thanks for listening to The Slippery Slope. Listen, I've been trying to ignore this subject. Obviously, they had the WEF, the World Economic Forum, just a couple weeks ago, I think it was, and there was some talk that came up during the conference about disease X. So I'd heard about this disease X. Read a little bit about it, and I thought, well, come on, surely. Are they doing it again? Are they doing it all over again where, they're giving us this little warning? Surely they're not doing it again. Is that, but then I think they are. Nearly every day, nearly every day on my news feed, something comes up about disease X and about the warning coming from the World Health Organization. So then today I'm reading this article that comes up. And it simply asks the question: Are we prepared for disease X? And it says the headline says, "What is disease X? What we know about the next pandemic." Now, this is the thing. I've been reading about this, thinking, well, it's just a thought experiment. Surely they're not going to be out there trying to sell it as something real, or are they? Is this just a whole other gaslighting event? Before we get into disease X, we have to go back in history a little bit and have a look at, you all remember the little conference that Bill Gates gave just before, just before COVID-19 really came out and thrilled all of our lives. Event 201. Event 201 was a high level pandemic exercise performed on October 18, 2019, in New York, New York, New York. The exercise illustrated areas where public slash private partnerships will be necessary during the response to a severe pandemic in order to diminish large scale economic and societal consequences. Event 201 simulated an outbreak of a novel zoonotic coronavirus. Zoonotic is just when it jumps from animal to human. Coronavirus transmitted from bats to pigs to people that eventually becomes efficiently transmissible from person to person, leading to a severe pandemic. The John Hopkins Center for Health Security, in partnership with World Economic Forum, WEF, and the Bill and Melinda Gates Foundation, hosted Event 201, a high level pandemic exercise. The exercise illustrated areas where public private partnerships will be necessary. Uh, where else? The pathogen and the disease it causes were largely modeled on SARS, but it is more transmissible in the community setting by people with mild symptoms. There's no possibility of a vaccine being available in the first year. This is their scenario. There is a fictional antiviral drug that can help the sick, but not significantly limit spread of the disease. And that was a big fat porky pie because there was always this antiviral drug, which now here in Australia, they'll give out willy nilly just about, mate. You're over 65, you got, or you're in some, certain classifications. I've got relatives, elderly relatives who are not, uh, well, they're very much in the latter part of their lives and not that healthy, very unwell, quite unwell. Had coronavirus a few times. They get the antiviral, doesn't affect them at all. And yet, when everyone else wanted it years ago, nah, can't bring in the antivirals, got to take the vaccine. Anyway, so they had this fictional antiviral. Since the whole human population is susceptible, during the initial months of the pandemic, the cumulative number of cases increases exponentially, doubling every week. And as the cases and deaths accumulate, the economic and societal consequences become increasingly severe. Remember, this is just the scenario. This is just what they were. They're kind of a war game that they were doing. They were gaming this out. Recommendations: governments, international organizations, and businesses should plan now for how essential corporate capabilities will be utilized during a large scale pandemic. Two, industry, national governments, and international organizations should work together to enhance internationally held stockpiles of medical countermeasures. Oh, God. Countries, international organizations, and global transportation companies should work together to maintain travel and trade during severe pandemics. Governments should provide more resources and supports. Global business should recognize the economic burden of pandemics. What else? International organizations should prioritize reducing economic impacts. Governments and the private sector should assign a greater priority to developing methods to combat mis and disinformation prior to the next pandemic response. Mis and disinformation, or anything that goes against the narrative that they're trying to sell you. Among the selected players, as they were called, remember this is event 201 before coronavirus hit the marketplace. So selected players, as I recall, was the Professor George Fu Gao, who was director of the Chinese Center for Disease Control and Prevention. I think that might be a typo. I think he's actually the director of the Chinese Center for Disease Spreading. There's no control coming out of the Chinese Center for Disease. Oh, since 2000. Anyhow, his specialization includes research on influenza virus interspecies transmission, host jump. He is also interested in virus ecology, especially the relationships between influenza virus and migratory birds or live poultry markets, and how to make money out of causing lots of sickness throughout the planet. Blah, blah, blah. Anyway, talks about here vaccines, Inovia Pharmaceuticals, and received $9 million from Gates backed CEPI, Coalition for Epidemic Preparedness Innovations. Anyway, look, so we had this event 201, in just before the pandemic came out. So now all this talk that we've had since the WEF. So let's read this next article. And you tell me, they're gaslighting us. They have to be gaslighting us because you know, so this headline, what is disease X? What we know about the next pandemic. Now, disease X is just a theory. It's not a fact. It's a theory. The next pandemic could be caused by something we haven't even discovered yet. But this hypothetical disease has already sparked a firestorm on social media. WHO boss Tedros Adhanom I can't remember how to say his name, has warned civilization is unprepared for disease X. Disease X, the hypothetical disease. We're unprepared. A term coined by the UN agency in 2018 to describe the unknown hypothetical pathogen that could cause the next pandemic in 2018. So the unknown pathogen. I mean, they had the one that came out in 2019. Obviously, that wasn't unknown because they made it in the laboratory. Because it's more of a thought experiment than an actual illness, nothing is certain about it. Nothing is certain. Nothing is certain about something as hypothetical. Who would have thunk that? We don't know what symptoms it would have because, again, it's supposedly, allegedly hypothetical. Are they for real here? They're having a lend of us, aren't they? They're having a lend of us. We don't know anything about a hypothetical disease. Okay, nothing's certain about the hypothetical disease that we don't know anything about because it's hypothetical. But here's what we do know. How fast it would spread, or even what type of pathogen would cause it. But according to some experts about a hypothetical disease, disease X could result in 20 times more fatalities than the coronavirus pandemic. It's on the WHO's shortlist of priority diseases, alongside viruses like SARS, Ebola, and Zika. What is disease X? Well, they're asking the question, what is disease X? It's hypothetical, I thought. Professor Dame Sarah Gilbert, principal investigator at the Pandemic Sciences Institute, University of Oxford, tells metro.co.uk that disease X is one of several future pandemic threats that scientists are working to build. Oh, sorry, working to understand. Slip of the tongue there. They're not working to create it. They're working to understand a disease that is hypothetical. Scientists believe disease X could be caused by a zoonotic virus, which is a virus that jumps from animals to humans. And Professor Dame Gilbert, sorry, I don't trust anyone whose first name is Dame. Dame Gilbert says the unknown pathogen, the hypothetical pathogen, which we think could likely be something we haven't yet discovered, something we haven't yet discovered. Or, as other people would say, something we haven't yet released from our laboratory. John Arne Rottingen, who's a Norwegian scientist and special advisor to the WHO, adds that zoonotic viruses represent probably the greatest risk to global public health. Some scientists think climate change, crikey, could increase the risk of zoonotic transmission. Here you go, climate change, the gift that keeps on giving, the alleged gift, the imaginary gift that keeps on giving. Warning climate could create the perfect conditions for mosquito borne viruses to spread, and the destruction of habitats means that humans and animals may come into closer contact. Golly. The WHO believes disease X, the imaginary disease that no one knows about, except for everyone in this article apparently, is likely to emerge in tropical, low or middle income countries, especially those already impacted by climate change. So it'll be a tropical environment, this country where this disease will come out. It'll be tropical, it'll have low or middle income, and it might have a laboratory, something like, something along the lines of the Wuhan coronavirus laboratory. And just, it won't be actually come out of that laboratory. It'll come out of the some kind of food market right next door to the laboratory. So that's what we know. In 2018, the WHO updated its list of priorities diseases that could cause future pandemics. A new version of the list is expected. So take in mind, this list is priority diseases. So if someone says to me, hey, priority diseases, this is a list of priorities, I would think that you're going to put down something that's a fact, that is an actual thing, not hypothetical. So this is the WHO's priority diseases: COVID-19, Crimean Congo, how do you say that? Hemorrhagic fever. Notice they've got Congo in the name of this disease here, and this illness. That's because Congo is not rich enough to make a stink about it and get their name taken out of it like what China did. Ebola virus disease and Marburg virus disease, Lassa fever, Middle East respiratory, which is MERS-CoV, Nipah and Henipa viral diseases, Rift Valley fever, Zika, and last but not least, disease X, which is an unknown hypothetical disease. Even though it's unknown and hypothetical, it still makes the WHO's list of priority diseases. You know what? There's a disease that we don't know anything about, that we're just guessing about, that doesn't even allegedly exist anymore, but let's put it on our priority list. That makes a lot of sense. Professor Dame Gilbert says the Pandemic Sciences Institute is working to understand, I think she means working to create, more about how viruses emerge, developing vaccines and treatments, developing a vaccine for a treatment for a disease that allegedly doesn't exist anymore, analyzing data and surveillance of infectious diseases, and researching the policy and ethical factors around pandemic response. Seriously, are these people come on. This is this is gaslighting at the most extreme, isn't it? Just before coronavirus, they have the event 201 saying, hey, we're going to see a pandemic. It's going to be this virus, this illness that, transmits from animals to people. And look, just so happens to happen a couple of months later, um, And here we have it, the WHO, talking about this imaginary illness, imaginary virus. We don't know anything about it. It's just whole hypothetical, but we're going to put it on our list of priority diseases, even though it's hypothetical, even though we don't know anything about it, even though that we're just making all this up. It doesn't really exist in a laboratory already, and we're not getting ready to release it on an unsuspecting population. Just trust us when we say that there might be another pandemic and it's going to be from a disease X. Seriously? They're gaslighting us, aren't they? That's my opinion. Let me know what you think. Pandemic on the way, 2024. My name's Jay Fallon. Thank you for listening to The Slippery Slope.
They just fuel a desire that will take me higher. I'm on